So let's go to talk about obesity, and we want to know what is specifically clinical obesity. I'm going to introduce my new interviewer. He's Francesco Rubino, consultant bariatric surgeon from King's College London. But you are from Italy, no?
I'm from Italy originally, yes.
Well, it's very nice to meet you, it's very nice to talk to you. Thanks for being with us.
Nice to meet you too.
So are you from Italy, but do you live in London?
I work and live in London, yes. I've been working in the United States before.
How long have you been working related with obesity?
Almost all my career. It's at least 25 years that I am a surgeon, a bariatric surgeon, focusing on obesity.
Focusing on obesity. What is clinical obesity and what is the difference?
Well, clinical obesity is an entirely new diagnosis. We very recently published a Lancet Commission, which is a big report with international experts that redefine entirely the notion of obesity. Clinical obesity is a disease. It's a disease that affects people and that is objectively documentable in the individual. And then we also define preclinical obesity, which means that people have excess adiposity, they have a risk for future illness, but they are not yet having a disease. So this is a new way of diagnosis who is sick and who is at risk but not yet sick.
And what is the difference in the concept?
Well, the difference in the concept is this. For many, many years, we thought about obesity as a risk factor for other diseases, right?
Yeah.
But obesity itself, obesity means having excess fat tissue. Excess fat tissue can alter the function of your organs, the heart, the liver, the kidneys, your joints, without the help of any other disease. It can do it just by itself. So you don't need to look at other diseases that complicate obesity. You can look in some cases at obesity itself and the way it affects your organs. And when it does, that is a disease, and we call it clinical obesity.
What is the treatment for the clinical obesity?
Well, treatment for we have very effective treatments for clinical obesity already. We have surgery that we know works very well, and we have also new medications that can be very useful in people with clinical obesity. What is happening now is that we have finally a tool to understand when we need to use those treatments for therapeutic intent, meaning to improve the clinical manifestations of obesity, to improve your heart function, to improve your kidneys, etc. And when instead we need to use interventions to reduce the risk of future disease, to reduce the risk of diabetes, to reduce the risk of cancer, etc. Those two things are prevention and treatment are completely different. We do that in medicine all the time. Until now, we didn't have a diagnosis of obesity that distinguished between the two, so we had a blurry picture. Now we just differentiate clinical and preclinical because preclinical will need preventative treatments. And clinical obesity, which is a disease here and now, needs therapeutic interventions.
Let's talk about bariatric surgeon and about the medication, Ozempic, semaglutide, GLP-1, etc. What are the difference? The pills are going to kill the surgery?
No, not at all. There's been
because
many.
They're different, no?
Sorry?
Are different.
They are different interventions. I think as we finally define obesity more properly, as we did with this preclinical and clinical, we will understand that different interventions have different roles. So you can use drugs for preventative interventions to avoid people to develop more severe disease. Sometimes you might need surgery for people who already have full-blown disease, and sometimes you will need both together. In the same way as we treat cancer, there are people who only need surgery. There are people who can do with chemotherapy, and there are other people who need both of them.
Let's talk about obesity. We are facing a very important and huge pandemic here in Chile.
Yes.
We have a lot of people with obesity, and also our kids. So we have to talk about that here in Chile specifically. So what are the risks of the obesity?
The problem is we have a pandemic of obesity. Everywhere in the world, there is no country that has seen a decrease in the number of people developing obesity. The medical profession, however, until recently hasn't been good enough at defining the problem in a way that makes it tractable. A blurry picture doesn't help anybody. Obesity is a spectrum.
It's a
There are-
spectrum.
It's a spectrum
Ah,
of things. So obesity can be a condition of adaptation to modern environment with relatively low risk. It can be also a condition with higher risk of developing diabetes or cancer. And in some people can even be a disease already without waiting for future developments. So being able to understand who is who is so important, because healthcare systems around the world cannot treat 1 billion people with surgery or with drugs. We need to become much more able to personalize care. So depending on what obesity means at the individual level, there should be appropriate intervention. Could be medications, could be lifestyle interventions, could be surgery, could be a combination of those. The same way as we do with any other medical illness.
What are the main causes of the obesity?
We don't really know what is the cause of obesity, especially the cause of the pandemic. For many years we have assumed that people are becoming sedentary, they're eating too much. As I said, we don't know what the cause is. One thing we know for sure is that it's not a lifestyle issue. It's a real problem that comes from alteration of our biological mechanisms that regulate your body weight. For some reasons, the exposure to modern food environments is driving an increase of our fat adipose tissue, the fat tissue. In some cases, this might not be necessarily a problem, but in others it can be.
Let's talk about the treatment. So, what is the main benefit of the different kind of treatment? For example, the bariatric surgeon.
Bariatric surgery has been invented in the 1950s. So
in the 1950s?
Has been around for quite some time. And we know pretty much how well it works. We know the safety of bariatric surgery, not just in the immediate term after the treatment, but also long term. And bariatric surgery, also called metabolic surgery, is not only excellent at treating obesity and making people lose weight and keep the weight down for many, many years, but metabolic surgery, bariatric surgery, can actually improve your diabetes. It can actually cure diabetes, type 2 diabetes, in many, many patients. We have data with randomized trials showing that 50% of people with diabetes who have surgery will not have diabetes and remain diabetes-free for 10 years and beyond. That is the closest thing we've ever seen to a cure of diabetes in our professional career.
As you say, obesity has multi-causes, yeah? It's not just junk food, it's because we have to move our body, it's biological problem, it's a lot. Yeah. But we know for sure that we have to eat better, yes, and we have to move our bodies because it's good. So how important is to change our mind, even if we do or we have a surgery?
There are two things that you have to consider in this case. One is what we can do as individuals. And certainly a healthy lifestyle is always good, because the problem is there is an environment, yep, where something is driving obesity. So certain habits may help diminish our risk of developing obesity. But there are certain things we can change. We cannot change how foods are prepared, how food industry prepares food and preservatives that are put in foods, etc. There is something certainly that is driving obesity. We don't even know yet what it is. And so there is very little we can do on certain things until we know better. But we can certainly change our habits and try to stay away from some of the most obvious culprits. But again, if we had the answer about what causes obesity, we would have a remedy. I don't think we are there yet.
Beyond the physical health benefit, what social and psychological impact do you see in your patients after bariatric surgery?
Bariatric surgery is really an extraordinary treatment. Not only is very effective, but patients who have bariatric surgery typically tell you, I regret I didn't do it before.
Oh,
because
really?
The suffering that comes with obesity very often is underestimated. People are always told, maybe I can try a diet another time, I can try maybe with physical exercise. When people need surgery, it is because those lifestyle interventions are no longer effective. And so the sooner they get the surgery, the sooner they can treat their condition, their disease. And therefore, sometimes they can come to surgery a little bit too late, but there is no question that surgery can improve the quality of life in a way that is spectacular, and people really enjoy coming back to the life the way they knew it.
Yeah, but Nowadays, we are talking about that topic and other topics related with obesity here in Santiago de Chile, in IFSO. So, for you, what do you expect from this meeting?
Well, this is an exciting meeting because
Yes.
I think it's at a turning point for obesity and for medicine. We are seeing, number one, an improved diagnostic of obesity. We have now finally defined clinical and preclinical obesity. This is aligning obesity care with the rest of medicine. We never had a diagnosis of obesity. We had a classification based on BMI, body mass index, which is not a diagnosis. It's just a measure of body size. Body size is not a medical diagnosis. Now we have that. Another important thing is that we have many different treatments. And this conference is actually putting emphasis on how we're going to be able to combine treatments and end up personalizing care, using each of these treatments where depending on patients' needs, and sometimes in combination when the disease is severe enough to require more than one just treatment.
How do you see Chile in compare with other countries related with the treatment of the obesity?
I think I've looked at Chile for quite some time now, because in my career I've been among some of my colleagues who developed this concept of metabolic surgery, surgery for diabetes. That was almost 20 years ago, and it was a quite novel idea. And Chile has been on the forefront with some of my colleagues, Camilo Boza and others, has been on the forefront of this new development. So I see Chile as a country that, especially in the surgical treatment for obesity, has been always on the innovation, and it was obviously in display here at this conference.
So are you enjoying our country?
Absolutely, yes.
It was very nice to talk to you. Thank you so much for this conversation.
Thank you for having me.
So see you in the other conversation. We are here in the context of IFSO. So see you in the next one.